Some basic facts I want you to talk about today. Are you aware that across the world, 1 billion people need mental health support? But there are no enough mental health workers to give them that kind of support. There are only 13 mental health workers for 100,000 people suffering from mental health. Just imagine, and these 13 also include mental health workers in the developed countries. So you can imagine what would the condition in the other countries. Similarly, if you really look at 40% of those 1 billion people would be needing family therapy. And I mentioned in the very beginning of this channel when I was discussing about setting up the channel with you that there are not many family therapists available. Not only in India, across the globe also it's a similar situation. That exactly is the reason we must focus on, besides the mental health conditions of individuals, on the family mental health too. Isn't it true that we need more and more people to handle family wealth and family health? I said family wealth because family health is the wealth also. So mental health of family is very important. That's what we are going to talk about today. We are going to discuss family counseling and family therapy. Hello, good evening. My name is Ramneek Kapoor. I'm your favorite family therapist, family counselor, counseling psychologist, perceptive meditation expert, and we have been talking for quite a while now. We want to discuss about and understand about family counseling and family therapy. But it is often I have seen in my sessions with people, they do not know what is family therapy. They do not know what is family counseling. Generally, both the words are interchangeable, but they have different purpose to serve. Family counseling can be the initial areas of family, where we sit together, we talk to people of the family, we talk to members of the family, we understand what is happening in the family. We also try to understand the constructs of the family, the boundaries of the family, the geographical boundaries, the physical boundaries, the respect boundaries, and also the interconnection boundaries of the family. This is one time when during the family counseling session, we want to understand everything about the family, from the beginning of the family till the latest day when people call on us. It's very important we understand the family first. And there the counseling matters. Counseling can be just the beginning, I can say, of interacting with the family. But family therapy is a different subject altogether. In the family therapy, we look at what are the inhibitions, what are the restrictions of interaction of the members of the family as a common unit. What are the conflicts? What are the areas where members do not see each other? What are the areas where members have emotional conflicts? What are the areas where members will have differences of opinions? Where are the areas where members can have other differences in their lifestyle, in their thinking, in their perceptions, in their understanding of each other, in their interaction with each other? In other ways, we want to say that the family therapy relates to completely understanding the issues that family suffers from, the issues that individual members of the family suffer from, the issues that really come in the way of the cohesive function of the family. As a family therapist, it's my duty to understand how the family is geographically connected. Nowadays, people are connected even though when they are physically not there. How are the boundaries operated in the family and where are the boundaries not adhered to? What are the constructs of the family? Where the constructs are not common, where the constructs are not in consonance with the ambitions and missions of individuals as well as family. What are the, I would say, relationships within the family, internally and externally, also with the outer families? This is what family therapy is all about, looking at the conflicts, looking at the conflicting emotions, looking at the conflicting interaction, looking at the maladies that the family suffer from. And from there on, the therapy begins. Generally, people believe that only one or two individuals in the family may need a therapy, but that's not true. Family therapy, in fact, is needed by every individual in the family, starting from the premarital sessions for family counseling, beginning to the post-marital understanding in the family, beginning from the new couples getting married in the family, interaction with the senior couples in the family, interaction between brothers, interaction between sisters, interaction between seniors, juniors, interaction between siblings. Everything is part of family. And that's what my job is as a family therapist. Help people understand themselves better, help people understand other members of the family better, help people deal with their emotions, help people read the other's emotions, and accordingly adjust their thought process and the lifestyle. So, family therapy is a very comprehensive treatment for any family in order to establish the cohesiveness, cumulativeness, at the same time taking care of the individual interest also. It can be a good family therapy when you talk of the youngsters also, then we are also establishing a connection between the youngers and the seniors also. When we understand the situation of newcomers to the family, whether they've come by way of marriage or they've come by way of living in relationships or they have come by way of simply birth into the family. So family is a very big subject, and so is family therapy, taking care of all areas of family. The financial, the physical, the emotional, the mental, the social, everything is involved in that. Family therapy is not dealing merely with sickness of somebody, but family therapy is dealing with how a family functions and act as a unified unit, taking care of the individual interests so that the conflicts can be avoided, the crises can be taken care of, and family particularly becomes an area where everybody enjoys their life within the family and outside of the family too. We shall be soon discussing the next area of family therapy as to what happens when you come to consult a family therapist. Next session, we will cover what happens, what we need to discuss, what we need to know, and how to approach a family therapy. Thank you very much. It was wonderful talking to you. I will request once again, please subscribe to our channel, please like our channel, please share our channel with your family and friends. But they also need sessions with us. They also need to understand their families. Don't you agree with me? I'm sure you do. Thank you very much for your time taken today. Namaskar. I'll see you next time very soon. Namaskar.